The graft survival rate is the single number that decides whether a hair transplant looks full or stays thin. And yet, most people never ask about it before they book. It matters more than the number of grafts on the day, more than the technique name, more than the price. In this video, we'll explain exactly what graft survival rate means, what a realistic number actually looks like, what makes a graft live or die. Knowing this is what separates a good result from a disappointing one. The hair graft survival is the percentage of transplanted grafts that take root in the recipient area and grow permanent hair. When a surgeon moves, say, 3,000 grafts, not every single one is guaranteed to survive the move. The survival rate tells you how many of them actually took. So a 90 survival rate on 3,000 grafts means roughly 2,700 grafts are still growing hair a year later. That's the truest measure of hair transplant success, far more meaningful than the number of grafts implanted on the day of surgery. A well-performed hair transplant typically achieves a graft survival rate in the region of 85 to 95%. An experienced clinic aims for around 90% or higher. There is no single guaranteed figure. It depends on the surgical team, the technique, and how carefully the grafts are handled. Be cautious of anyone promising 100% survival, because that's not how biology works. A consistent result in the low to mid-90s, confirmed at the 1-year mark, is an excellent and realistic outcome. Graft survival depends mainly on how gently the grafts are handled and how little time they spend outside the body before they're implanted. The biggest factors are the time grafts spend out of the scalp. The longer they go without a blood supply, the lower their viability, along with any mechanical trauma during extraction and placement, and how well they're kept hydrated at the right temperature. The way the reception channel are created also matters, because their depth, angle, and spacing decide whether each graft can plug into a healthy blood supply. And underneath all of it is the skill of the surgical team, which is the variable that ties everything else together. Graft survival is properly assessed around 12 months after surgery, once the transplanted hair has shed and fully regrown. Transplanted hair usually falls within the first weeks. That's normal shedding, not failure. New growth typically starts around month 3 to 4, and the final picture is in by roughly month 12. Good clinics don't eyeball this in mirror. They measure it by counting grafts in defined areas using trichoscopy, magnified calibrated scalp imaging. At Vera Clinic, the assessment is done with tools like the trichoscopy AI, so the result is tracked with real numbers rather than guesswork. Neither FUE nor DHI is automatically better for survival. What matters far more is how carefully the procedure is performed. Both techniques can deliver excellent survival in skilled hands. What protects graft is minimizing trauma and keeping their time out of the body as short as possible. This is where technique refinements earn their keep. Sharper blades make cleaner channels with less tissue damage, and implanter pen methods like DHI cut down on handling. At Vera Clinic, Sapphire FE blade and the Vector 10 lab-grown diamond blade are used specifically to create cleaner incisions and reduce scalp trauma. And OxyCure oxygen therapy is applied afterwards to support the healing in the reception area. All of it aimed at giving each graft the best possible chance to survive. The stage of hair loss doesn't change the biology of an individual graft, but very advanced hair loss can make the overall result harder to plan, because a fixed donor area has to cover a much larger bald zone. In more advanced cases, the demand for grafts is high while the donor supply is limited, so planning density and coverage carefully becomes critical. That's why a realistic assessment of your donor area and your degree of hair loss, usually described using the Norwood scale, is done before any surgery. The aim is simple: set expectations that match what your donor area can actually deliver, rather than overpromising coverage it cannot support. In fact, a Vera Clinic analysis of 824 FUE patients found survival stayed high across hair loss stages, with 94% in earliest stage and 87% in the most advanced cases. The biggest thing you can control is choosing an experienced surgical team, and after that, following your aftercare instructions closely is what protects your grafts. In the first days, grafts are fragile and not yet anchored. Protecting them means sleeping in the position you're instructed to, avoiding any knocking, rubbing, or scratching of the area, following the exact washing routine you're given, and staying away from smoking, alcohol, heavy exercise, and direct sun during the early healing window. Supportive treatment like PRP, which is included in our packages, are also used to encourage a healthy environment for the new grafts. Done properly, this is what turns a good surgery into a good result. No pressure assessment of your donor area and a realistic estimate of what's achievable for you. Graft survival is the number that decides your final result, so it's worth getting it right. At Vera Clinic, with over 13 years and more than 40,000 patients, every step from Sapphire and Vector 10 blade incision to OxyCure aftercare is built around protecting that survival rate. If you're considering a transplant, you can send us your photos for a free, no-pressure assessment of your donor area and a realistic estimate of what's achievable for you. Subscribe for more straight answers about hair restoration and check the link below to learn more about graft survival and the technique we use.